Hi, this is Dion King. I'm going to do the insertion of the NG tube. Now, before I enter the patient's room, I have checked the chart. The doctor has ordered an NG tube insertion. So at this time, I will be simulating NG tube insertion.
Come in.
Hi, I'm Dion. I'm your nurse. How are you? Okay, I'm just going to write my name on the board. For Dion, today's date is the 30th. Okay, can I get your name and your birth date?
Marie Martin, 0225-2000.
Okay, Marie. Give me a little hand sanitizer on. Okay, Marie, do you have any allergies?
No, ma'am.
Okay, do you have any pain?
No.
Okay, so first and foremost, we're going to be doing the NG tube, as I said before. So several things we have to do. First thing that I would like you to do, just blow your nose, get any loose sputum in your nose and your throat. Okay, thank you. That goes in the garbage. Hand sanitizer. Okay, so the first thing that I'm going to do, I'm going to inspect your stomach. Okay, I'm going to go under your gown if you don't mind.
Okay.
I'm going to inspect the stomach. Yeah, stomach's a little distended. Oh yeah, you're gonna need this too. Bowel sounds aren't good. Okay, I'm gonna palpate. Okay, thank you, Marie. Okay, I'm gonna place this post-op. This will stay on. We're gonna keep this on your hand during the procedure so we can observe for any respiratory distress. Okay? I'm gonna get my gloves on and start to put the equipment together. Okay, I have my gloves on. Okay, I have 2 cups of water here, one for the patient and one to flush the tube. I have my tape, measure. Okay, I'm gonna put this chuck on you, Marie. Well, actually, I'm gonna do that after I measure the tube. So I'm gonna measure the tube from the nose, tip of the nose, to the earlobe, and I need to go under your gown, Marie,
Okay.
so I can measure to the xiphoid process. It's kind of awkward, but I need to get under your gown. Get under your gown here. Okay, so tip of the nose to the earlobe, and down to the xiphoid process. I have my measurement, sorry, Marie. So I'm going to tape off where I measured. So we don't go too far inside, Marie. Okay, so I have my tube taped off. I'm going to measure my tube so I can know how many inches, going in centimeters. And that's going to be about 45 centimeters. Okay, leave that right there. I'll put this chuck under you, Marie. Okay. Now I'm going to get some lubricant for the tube. Lubricate the tube. Marie, you're going to hold this water as I insert. We're going to, you may want to take some sips of water. That'll facilitate the tube going down to your esophagus, okay? Okay, yes. So you can try to take a couple of sips now. That's great. Okay. So I'm going to put it in the right mirror. And I'm going down and down and down until I get to the back of the throat. I'm going to inspect. Make sure I'm not coming out the mouth. Now that we're at the throat, Marie, I need you to hold your face forward so we continue to pull the tube down and down. there we are. So I have to tape this part to your nose. And then before we can continue, I'm going to get my flush. I have a stethoscope over the stomach, and I'm going to pull back about 30 milliliters of air. Ooh, I heard a whoosh sound. It means we have proper placement. So I am going to secure. Where's my tape? Oh, I'm going to secure the placement of the tube to her cheek, and I'm going to secure it to the gown. Give the patient enough slack. This tape doesn't tape. So the stick. So I'm going to secure it to the gown so the patient moves her head from side to side. Are you okay? Okay, so from there, I'm going to take your water, Marie. Are you sure you're all right? Okay, so I'm going to put Marie back in her position. Side rails up by 2. Make sure she has a collar light. Collect my chucks. Okay, Marie, I'll be back to check on you in a little while, okay?
Thank you so much.
Okay, Marie's gonna stay right there. I'm going to go document. Document what I just did. My pen doesn't work. I gotta go get a pen, hold on. Okay, I'm documenting my procedure. I instruct the patient on the healthcare provider order for an NG tube. The patient verbalize understanding and agrees with plan of care. I use a 16 French NG tube inserted into right there at 45 centimeters in depth. Gastric contents aspirated were light yellow, and that is, I did forget to aspirate the patient's tube and to check the pH. Patient tolerated procedure without difficulty. And the oxygen stats remained between 96% and 99% during procedure. Position the patient for comfort. Patient for comfort at 45 degrees. And SR times 2, call light within reach. And waiting confirmation from X-ray. Replacement from X-ray. And that is Dion King, student nurse. Okay. That is my documentation. And now, I'm gonna quickly move on to removing the NG tube. So here we go.
Hi.
Hi Marie, how are you?
Alright.
Okay, give me some hand sanitizer here. Writing my name on the board, Dion is 330. Okay, today Marie, I looked at your chart. The doctor is ready for you to get off the NG tube today. Okay, so I'll be removing it today. Okay, at this point, we know that since she had the order, it's probably confirmed already. I'm going to disconnect Marie from the suction machine, and I'm going to turn the suction machine off. I'm going to get my gloves on. I'm going to get my gloves on so we can remove the tube. First, I'm going to check her abdomen, assess her abdomen. We want to assess, inspect, auscultate. Palpitate. Marie, got any pain?
No, ma'am.
Okay. You don't have, remember you don't have any allergies, right?
No.
Okay. So we have inspected the abdomen. Everything is good. She has her bowel sounds right, so we're good to go on removing the tube. So now, going to get some lube. Have a cup of water for Marie again, just in case she needs that. I'm going to keep the pulse ox on. And first and foremost, also take for air. Make sure it's still in the right place. I'm going to draw back. 30 cc's air. Yeah, I got my whooshing sound. Okay, then I'm going to draw back, get my gastric juices. Okay, pH is at 3.5. Good with that. Okay, now I'm going to take feel free to take some water. I'm going to pull back some water. I'm going to aspirate the tube. Let me take a listen while I do this to make sure. Okay, got the water aspirated into the tube. Okay, I'm going to remove the tape. Oh, forgot the chuck, just in case she has an accident. Put the chuck back on. I'm going to remove the tape from her face. Okay, Marie, you might want to cough. Make sure you're sitting all the way up. I'm removing the tube. Moving the tube. Okay. Good job, Marie. The tube is out. How are you feeling? Okay, I'm going to put Marie back in the same position. Before, I'm going to make sure, give her some mouth care, give her some facial care. Okay, so I'm going to make sure she's back in proper position. Side breath times 2. I'm going to document that HCP ordered NG tube removal. Patient was instructed on the removal of NG tube. Patient verbalized understanding and agrees with procedure. So I did remove the tube from Marie. Patient tolerated the procedure. After the procedure, the patient was put in 45-degree position, and let's see, she put in 45 degrees position, and call light was within reach. Patient understands that if they need anything, they can contact us. And during this procedure, the patient should have been placed in high Fowlers in both instances. And thank you, Professor, and I hope this is good.